Hello friends, welcome all of you on my YouTube channel here, Anand's Nursing File. Today in this video, we'll learn about the Cardiomyopathy Nursing Care Plan. This is very important nursing care plan from the cardiovascular system here. And in this video, you learn this care plan very easily, very simply, and this is useful for you for the examination purpose or for the practical file work purpose or assignment work purpose. Friends, for more nursing care plans, case study lesson plans, I'll talk. सब्सक्राइब माई यूट्यूब चैनल यार आनंद नर्सिंग फाइल। तो आइए देखते हैं हमारा आज का जो वीडियो है कार्डियोमायोपैथी नर्सिंग केयर प्लान। Before going to nursing care plan, we are learn short introduction about cardiomyopathy here. Cardiomyopathy means disease of the heart muscles. Here, cardiomyopathy is a disease of the heart muscle that makes it hard to pump blood to the rest of body. Cardiomyopathy can lead to heart failure. The main types of cardiomyopathy include dilated, hypertrophic and restrictive cardiomyopathy. Next देखते हैं defining characteristics में यार means here the sign symptom of cardiomyopathy include breathlessness with activity or even at rest, swelling of the leg, ankle and feet, bloating of the abdomen due to fluid buildup next cup while lying down, difficult lying flat to sleep, fatigue at feet that feel rapid, pounding and fluttering, air chest discomfort or pressure, dizziness, lightheadedness, and faintings. These are the sign symptoms of cardiomyopathy. On the basis of these symptoms, we write here the nursing care plan. Here, nursing care plan number first. Here we use here the different nursing processes type that is nursing assessment, diagnosis, sorry, goal and or desired outcome, nursing intervention, rational and evaluation. Here in nursing assessment, here first we learn here subjective data. A patient is saying that I am having breathing difficulty during activity and fatigue, and objective data regular heartbeat. Next nursing diagnosis here decreased cardiac output related to damaged heart muscle. गोल होगा यहाँ पर to maintain adequate cardiac output. Nursing interventions and rational देखते हैं first assess the patient's vital sign and characteristics of the heartbeat at least every 4 hours. Rational means specific reason for this intervention to assist in creating an accurate diagnosis and monitoring effectiveness of the medical treatment. Next second देखते हैं assess the breath sound by auscultation. Rational होगा breath sound of crackles rails are important sign of heart failure which is a complication of cardiomyopathy. Next observe for sign of decreasing peripheral tissue perfusion such as facial pallor, cyanosis and cool and clammy skin. Here rational look up peripheral tissue perfusion indicate deterioration of the patient's status which require immediate interventions. Next administer the cardiac medications and as prescribed here to alleviate the symptoms of cardiomyopathy and to treat the underlying condition. Next administer supplementary oxygen as prescribed here to increase the oxygen level. Next educate patient on stress management, deep breathing exercise and relaxation technique. Here rational होगा stress causes persistent increase in cortisol level which has been linked to people with cardiac issues. After providing these interventions, we write here the evaluation steps. Here evaluation of is first diagnosis. Now maintained adequate cardiac output. गोल था हमारा to maintain adequate cardiac output को हमने अचीव किया है through these interventions. नेक्स्ट देखते हैं केयर प्लान नंबर सेकंड. ये सेकंड केयर प्लान होगा हमारा impaired gas actions. इसमें देखते हैं नर्सिंग असेसमेंट में सब्जेक्टिव डाटा patient verbalize about difficulty in breathing and objective data here assess vital sign, ABG steady, crackles on exertion. नेक्स्ट नर्सिंग डायग्नोसिस लिखेंगे यहाँ पर impaired gas action related to alveolar edema due to increased left ventricular pressure. गोल होगा to maintain normal gas actions. नर्सिंग इंटरवेंशन रेशन लगते हैं. First intervention, assess the patient's vital sign and characteristics of the respiration at at least every 4 hours. रेशन होगा to assist in creating an accurate diagnosis and monitor effectiveness of the intervention. Next, second देखते हैं यहाँ पर administer supplemental oxygen as prescribed. रेशन होगा to increase the oxygen level. Next, third intervention, encourage small but frequent meal. रेशन होगा to avoid abdominal distension that's cause decrease in lung capacity. Next, elevate the head end of the bed and assist the patient to assume semi-Fowler's position. रेशन होगा head elevation and semi-Fowler's position help improve the expansion of the lung, facilitate breathing effectively. After providing these interventions, we write here the evaluation steps. यहाँ evaluation होगा maintain normal gas exchange. जो हमारा गोल था to maintain normal gas exchange, उसको हम यहाँ पे इस तरह लिखेंगे. मीन्स 2 को हटाना है, maintain में ed लगना है, maintained normal gas exchange. नेक्स्ट देखते हैं थर्ड केयर प्लान. थर्ड केयर प्लान देखते हैं अपन. नर्सिंग असेसमेंट, डायग्नोसिस, गोल, इंटरवेंशन, रेशनल एवेल्यूशन. फर्स्ट नर्सिंग असेसमेंट में सब्जेक्टिव डाटा, पेशेंट कंप्लेंट वीकनेस, फटीग एंड डिफिकल्ट टू डूइंग एक्सर्शनल एक्टिविटी. ऑब्जेक्टिव डाटा, चेंज इन द वाइटल साइन एंड द प्रेजेंस ऑफ डिसरिथमिया. नर्सिंग डायग्नोसिस देखते हैं. एक्टिविटी इंटॉलरेंस रिलेटेड टू एन imbalance between oxygen supply and demand secondary to cardiomyopathy. गोल हो गया यहाँ पर patient will be able to demonstrate an increase in activity tolerance. Nursing intervention रेशनल देखते हैं. First, assess the patient baseline vital sign before and after activity. रेशनल होगा baseline information help in interventions. Next, record cardiopulmonary response of the patient in relation to activity. रेशनल होगा the patient with cardiomyopathy and insufficient stroke volume capabilities during activity can cause rapidly elevated heart rate and oxygen demand. Next, record and assess the patient's response to activity. Here, help to provide information. Next, assess the patient for increasing activity. Increasing intolerance means elevating cardiac decomposition and not simply over activity alone. Therefore देखते हैं फिर से. assess the patient for increasing activity intolerance. This is activity intolerance. here रेशनल होगा increasing intolerance may means elevating cardiac decomposition and not simply over activity alone. Next, help patient rendering self-care activity when needed. Allow the client for independent within the allowable limits. Here rational होगा improving their sense of control. Next, sort out care activity in order to promote rest period. Here rational होगा ensure for conserve energy for other activity. Next, utilize a measured cardiac rehabilitation program. rational होगा a rehabilitation program guide the client by improving cardiac functions. After providing these interventions, we write here the evaluation steps. evaluation होगा. Now patient is able to perform activity as usual. मीन्स जो गोल था patient will be able to demonstrate and increase activity tolerance, वो यहाँ पर complete हुआ है through these interventions. Next देखते हैं केयर प्लान नंबर 4. नर्सिंग केयर प्लान नंबर 4 हो गया यहाँ पर. नर्सिंग असेसमेंट, डायग्नोसिस, गोल, इंटरवेंशन, रेशनल एवेल्यूशन देखते हैं. नर्सिंग असेसमेंट Here subjective data, here objective data, oliguria, presence of edema, jugular vein distension. Nursing diagnosis: excess fluid volume related to reduced glomerular filtration rate and decreased cardiac output secondary to cardiomyopathy. Goal होगा desired outcome. Patient will be able to stabilize volume achieved by balance intake and output. Here nursing interventions. First, take note of the patient urine output, including the amount, color, and take time and frequency of urination occur. Rational होगा patient with cardiomyopathy may have compromised kidney. Then monitor intake and output. Rational होगा achieving a balanced intake and output will ensure that therapy for cardiomyopathy. Here utilize the fluid intake schedule, especially the restricted for the patient here, or achieve involvement of the patient. Here number 4, monitor patient weight daily. Rational होगा effective method for determining fluid volume. Next, evaluate the patient for distended neck and peripheral vessel and examine the dependent area for the presence of edema. Rational होगा यहाँ पर too much fluid retention in body can manifest by venous engorgement and the formation of the edema. Next, employ the assistance of a dietitian. Here, the dietitian will be helpful in formality and applicable meal plan for the patient. After providing these interventions, we write it. The evaluation here. Evaluation होगा. Now stabilize fluid volume. Means जो हमारा goal था, patient will be able to stabilize volume achieved by the balance intake and output. वो achieve है through these interventions. Next देखते हैं number 5th care plan here. Nursing assessment: subjective data, patient verbalize about weakness and chest pain. Objective data, assess vital sign dysrhythmia, compromised breathing, presence of pitting edema on the patient limb. Here, this is pitting edema. Next, nursing diagnosis होगा ineffective tissue perfusion related to decreased cardiac output secondary to cardiomyopathy. Goal होगा to maintain normal tissue perfusion. Nursing intervention is like the first, evaluate the patient pain by taking notes of the intensity, location, and precipitation factor. Rational होगा provide visual information for the intervention. Next, observe and record the patient vital sign, especially the heart rate and blood pressure, every 5 minutes until the pain minimizes. Sorry. Rational होगा hypertension and tachycardia can appear together with the angina. Next, evaluate the cardiac specific marker, creatinine, phosphokinase, LDH, troponin, CKMB, myoglobin, etc. Rational होगा these enzymes are released by the blood as response to cardiac injury or infarction. Next, number 4 देखते हैं. Monitor patients cardiac rhythm. ये rational होगा abnormal rhythm indicate cardiac compromise. Here 5th intervention देखते हैं. Administration of the vasodilators as prescribed. Rational होगा improve the circulation of the blood. Next, administer beta blockers as ordered. Rational होगा beta blockers are effective medications cardiomyopathy due to their action on the heart. Next, administer oxygen as prescribed. Rational होगा to meet the oxygen demand. Next, number 8, instruct the patient on relaxation method and other techniques. Here 8 rational होगा to reduce stress and provide relaxation to the patient. Next, educate the patient on the difference between the angina and myocardial infarction manifestations. Rational होगा the patient should understand how to distinguish one from another and seek immediate family medical care. Next, after providing these interventions, we write here the evaluation. यहाँ पर evaluation होगा टिश्यू परफ्यूजन मेंटेन्ड. जो गोल था पर टू मेंटेन नॉर्मल टिश्यू परफ्यूजन वो अचीव हुआ थ्रू दीज इंटरवेंशंस. तो फ्रेंड्स, ये था आज का हमारा वीडियो नर्सिंग केयर प्लान ऑन कार्डियोमायोपैथी. आपको वीडियो कैसा लगा इसके लिए अपने लाइक कमेंट जरूर भेजिएगा एंड शेयर दिस वीडियो विद अवर फ्रेंड्स एंड subscribe my YouTube channel Anna Nursing File Preparation for the Nursing Competition Examination and press bell icon also. Thank you.